Welcome to my friends and colleagues and loyal subscribers to Urological Coding Alert. I'm Dr. Ferragamo. I'm going to be your presenter for this audio conference. I do hope you have your handout and you'll be able to follow the slides along with the handout. Let's look at page 1, and that's to get the topic for this presentation. And it's 2021 Uro-oncology Coding Update. Let's go to page 2. Now, the first thing I'd like to talk to you about is the change and the coding for the BCG shortage that we are experiencing. And I'd like to talk about how to code for split doses of BCG between patients. Now, the AUA coding told us that effective on July 1st, 2019, we would have a new HCPCS code, J9030, which will replace the HCPCS code J9031. The J9030, it's BCG, it's live, it's attenuated, it's a 1 milligram is the unit, and it's used intravesical installation. And we now bill it per the amount used. Now, if we look at one vial of BCG, that BCG vial contains approximately 50 milligrams of freeze-dried powder. And 1 unit is equal to 1 milligram is equal to $2.85 per unit. And this is the fee schedule from January to April 30th, 2021, Part B drug fee schedule. So that if we look at a vial, the Medicare Part B payment for a full vial would be $142.50. Now, if we go to page 3, let's look at how we're going to bill the split doses of BCG between 2 patients. Now, patient number 1, remembering that the BCG vial contains 50 milligrams, you're going to bill for the installation, the 51720, plus the drug, the J9030, plus a drug report that we'll mention in a moment. And we're going to give half a vial, so we're going to give 25 milligrams times the unit cost of $2.85, and that drug cost is going to be $71.25. Now, patient number 2, we would bill exactly the same way. He receives the other 25 milligrams of BCG from the vial, and that's going to be multiplied by $2.85 again to give them a price for the drug for the J9030, that's $71.25. Now, you should mention when you do your billing that you put the 25 in the 24G column indicating the units that you're using. Because if you put 1, as you did in the past for the vial, they're only going to pay you $2.85. Let's go to page 4. And let's look at what is required in the required drug information report. And this we enter in box 19 of the 1500 form, the 1500 insurance submission form, or the equivalent electronic health record box. We're going to put down the name of the drug is TICE BCG. The dose administered is going to be per milligram up to 50 milligrams. The route of administration is going to be intravesical. And the National Drug Code, the NDCN, I have written for you, so you will also report that. But also remember to be ready to provide a paid invoice for the purchase of the BCG that you did if requested by the payer. Now let's go to page 5, and I'd like to talk to you, go over the 2021 Pelvic Exhibitoration Code. And that's for a complete exhibitoration for vesicle, prostate, or urethral malignancy. And that code is 51597. Now in the male, this will include excision of the bladder and prostate, an excision of the anus, rectum, and a portion of the sigmoid, colon. It'll also include a bilateral pelvic lymphadenectomy and a colostomy. Now in the female, the code 51597 for a complete pelvic exhibitoration includes the excision of the bladder, the excision of the uterus, tubes, and ovaries, excision of the anus, rectum, and a portion of the sigmoid. It includes a bilateral pelvic lymphadenectomy and a colostomy. Now you're going to bill separately for the urinary diversion. Separately, in other words, you're going to build a 51597 and then the various diversions. If you do an ileal conduit, you're going to build a 50820 modifier 50. If you do a sigmoid conduit, 50815 50. Or if you do a continent neobladder, you're going to build a code 50825. Let's go now to page 6, and let's look at renal oncology, and let's look at ICD-10-CM covered diagnoses. Let's look at malignant neoplasms of the kidney. These are malignant renal tumors. Basically, these would be the various renal cell carcinomas. And if it's a left-sided, if it's a right-sided tumor, you're going to build a C64.1. And if it's a left-sided tumor, C64.2. The unlisted or the unspecified tumor of the kidney, we really shouldn't use because many carriers may not pay for unspecified diagnoses. So try not to use the code C64.9. Now, you also have tumors of the renal pelvis or calyces, and a right-sided tumor would be C65.1, and a left-sided tumor of the renal pelvis or calyces, C65.2. Again, the code C65.9, unspecified tumor of the renal pelvis or calyces. Try not to use those because many carriers do not pay for unspecified diagnoses, especially when you have better diagnoses to choose from. Now, what about benign neoplasms of the kidney? And these would represent an adenoma, an oncocytoma, and an angiomyolipoma. And if it's a right-sided neoplasm, benign neoplasm, it's D30.01. A left-sided benign neoplasm would be D30.02. Do not use the unspecified benign neoplasm, D30.00. Then we have tumors of the renal pelvis and calyces. Benign, that would be D30.11 for right-sided tumors and D30.12 for left-sided benign neoplasms of the pelvis and calyces. Do not use the unspecified or the unspecified D30.10, especially if you have other more exact diagnoses that can be used. Now, carcinoma in situ of other urinary diagnoses would be D09.19. This would be carcinoma in situ of other urinary organs. Let's go to page number 7, and let's look at secondary renal tumors. C79.01, secondary tumors to the right kidney, and C79.02, secondary tumors to the left kidney. And these represent metastases from the lung, most commonly, or other tumor sites to the kidney and or renal pelvis as metastatic tumors. Let's go to page 8. Now, we're also finding that many times we have an undiagnosed renal mass lesion. And you can bill that as a malignant tumor if that's what you think you have, renal cell carcinoma, Or you can bill this as an undiagnosed renal, it may be a malignant tumor of the renal pelvis or calyces. This would be a transitional cell carcinoma. We do have a code for a renal or kidney mass, N28.89, and we do have a code D49.59. This would be a neoplasm of unspecified behavior of other genitourinary organs. And this code would also be path pending for any biopsies or tissues from kidney, pelvis, or calyceal biopsies.